Good afternoon, everyone. I'm Cameron Friesen, Minister for Health, Seniors and Active Living, and I'm here, of course, with Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer, here for our Thursday briefing. Dr. Roussin, over to you.
Well, thank you, Minister. Good afternoon. Our current 5-day COVID-19 test positivity rate is 1.9%. 33 new cases have been identified as of 9:30 a.m. this morning, bringing our total number of lab-confirmed cases to 796. 17 new cases in the Prairie Mountain Health region, 10 new cases in Southern Health, and 6 cases in the Winnipeg region. We have 247 active cases, and 537 individuals have recovered from COVID-19. The number of deaths due to COVID-19 is 12. Due to a technical issue, our current status of hospitalizations and intensive care patients is not available at this time. We'll update it in future bulletins. Our testing yesterday was 1,596 tests performed, taking our total to 119,210. An update as far as our clusters go. In Prairie Mountain Health, there are 95 active cases currently. The majority of cases continue to be in Brandon. There are 66 cases associated with a business in Brandon and 61 with the Brandon cluster. 21 cases are members of both clusters, and 17 cases are associated with other regional clusters. We continue to see increasing numbers in the Brandon region, and we are seeing increasing community-based transmission as well. I'm hearing of many reports of large gatherings in parks, family gatherings, as well as religious gatherings. Due to the increased number of cases, as well as community transmission, as well as the significant reports of increased gatherings, the Prairie Mountain Health region is being elevated to the restricted level, or orange, in our pandemic response system immediately. This is a rapid changing situation. It'll take some time to facilitate these measures. And so while the elevation to the restricted level begins immediately, the following restrictions will be implemented on Monday. Group size will be reduced to 10 individuals, both indoor and outdoor. Masks will be made mandatory for indoor public places as well as any public gatherings. And more details will be coming later this afternoon outlining these measures. We have 2 potential exposures of COVID-19 to alert Manitobans to. The first was August 8th at Manipogo Provincial Park, located off Highway 276 on Lake Winnipeg. The second exposure was August 8th at Crocus Soccer Field, 930 First Street, Brandon, Manitoba. And additional details will be updated on our website. While the risk of transmission is considered low, we are again informing Manitobans of the potential risk and to continue to monitor for symptoms and seek testing should symptoms develop. So a number of these exposures serve again as reminders to self-isolate as soon as symptoms develop, no matter how mild they are. And that self-isolation means staying at home, avoiding others in your household. Certainly people should seek testing as soon as symptoms develop. Again, messaging about the to avoid attending for asymptomatic testing. If you don't have any symptoms of COVID, we're not recommending to attend for testing unless you've been advised to by a healthcare practitioner. And the same goes to employers to not suggest your employees go for asymptomatic testing. So we know we've seen these increasing numbers in a number of regions, certainly the increasing numbers in the Brandon and Prairie Mountain Health region, which required now the elevation of that risk level. But Manitobans need to remember that we have those concrete steps to, again, reduce the transmission of this virus. We've done it before, and we know exactly what we can do. And that's those fundamentals that we discuss about. Staying home if you're ill, even with very mild symptoms. Washing your hands frequently, don't share items with others, and practice physical distancing when you're outside of your household. And so a number of issues in the Prairie Mountain Health region of these large gatherings, of house parties, and we just know that this is where this virus is transmitted. So practice that physical distancing, avoid those indoor crowded places, and once again, we'll start seeing these case numbers diminish. As we're releasing more and more detailed information, especially around geography, we all have to be mindful of the role stigma has played. And again, stigma counters our ability to manage this pandemic. So please use this information wisely that we're providing, but be sure that we're not stigmatizing groups based on this information. We are definitely in this together, and we're going to have to continue to work together to see this pandemic through. So visit our website, manitoba.ca/COVID-19 for up-to-date information, and we can open up for some questions.
Thank you, Doctor. We go to the phone first today to CBC Radio Canada and Gavin.
Hi, Dr. Roussin. I was wondering if you could provide a bit more detail on the gathering limit of 10 people. What sort of places does this apply in?
So our public gatherings, it's going to be the same as in any of our orders, and we've been up and down with those in the past. But it's to public gatherings, so it applies to things like events. Such as weddings and funerals, as well as public family get-togethers, and so it doesn't apply to workplaces, and it doesn't apply to any other establishments that are already dealt with under the order. So it doesn't apply to retail outlets. Retail outlets have their section of the order that require them to maintain physical distancing. Religious ceremonies have their own section in the orders, and those will remain the same at this point.
Do you have an idea at this point how long these measures will have to remain in place before they can be lifted?
Yeah, and so we know that the incubation period of this virus is around 14 days. And so any measures we implement take some time to show an effect, and then we need to see that effect for some duration in the meantime. So orders such as these would definitely be in for a minimum of a single incubation period, much more likely at least 2 incubation periods, and longer depending on what the response is we see.
From the Canadian Press, Steve.
Dr. Roussin, with the Code Orange designation now, I just want to make sure I understand. Public gathering sizes will be capped at 10. Are there any other new restrictions that are possible under Code Orange? Are any others being implemented in the Prairie Mountain Health region, such as limits on restaurants and other businesses, that sort of thing?
Right, yeah, so good question. So it is the mandatory mask. So that is an additional one that's being added. But this was the whole purpose of this response system, is to tailor it to the epidemiology. So the epidemiology we received is that a lot of transmission events are taking at these gatherings. So large gatherings, beaches, parks, public gatherings. We haven't seen a lot of transmission, say, at restaurants. So we're not implementing any further restrictions in those areas at this time.
Okay, and when you say mandatory masks, what do you mean?
Yeah, so what is that masks will be required in indoor public places, as well as any public gatherings. So even outdoor public gatherings, a mask will be worn. And of course, when they're mandated, there will be exceptions, certain medical reasons, and even age restrictions. But there'll be more details on that as the day prolongs and as the weekend unfolds.
From CTV Winnipeg, John.
Dr. Roussin, you mentioned that there were a lot of gatherings, parties, and so forth. Can you give us some more details just about what you've heard about these different events? And also, how would you characterize this sort of behavior, given that there has been so many clusters in that particular part of the province?
Yeah, I think that the number of these, so we've heard of some of these recent gatherings where they're sometimes a religious gathering outdoors, a public gathering, family gatherings, and just large amount of people at a beach. We've had cases that have been identified that have been at those places. We've had cases that may have acquired it at events like that. And so I characterize it as just that we've lost touch with the the fundamentals, the things that got us to success early on. And it's easy to see why. It's only human that we've been through a lot, some challenging times, and it's a beautiful Manitoba summer, and people want to get out and do things and see their friends and family. But we know that this is the result, that this virus is spread from close, prolonged contact. And so we need to increase that level of restriction right now before things get out of hand.
Given that so many people were flouting the fundamentals, as you say, what sort of efforts will be made to ensure compliance with these new restrictions that are being put in?
So I think that that we always get back to to the basics, that when we raise the level of alert, when we increase our messaging like this, we get a lot more compliance. And so we're expecting that raising the level to orange, that many people are going to be alerted to the fact that we need to change behavior. But we always have that ability to enforce things under the orders, and I think that we will look to do so. We're really trying to keep things moving in Manitoba. We want to get the kids back to school. So if it means we have to enforce compliance on mostly a minority of people who are, just losing track of what's important right now, then we will.
From City News, Jonas.
Dr. Roussin, just to touch back on how long these restrictions could be in place for Brandon, we're going to probably roll through the start of, we will roll through the start of school with it. Is that going to change anything there?
So we've moved the restriction level just today, and certainly we're engaging with the educational system now to make plans to be in this restricted level, which could change the look of some of the return in those areas. You could read the education plan, Return to Safer Schools plan, which outlines what may look when we're in more of a restricted area. It may be more of a blended learning component. Certainly there's going to be a priority for those K-8 students to still be in class, but things certainly could look different.
And a follow-up for parents that are wondering, when they'll know what shape things are going. Again, we're 2 weeks away. This is going to have to change quick, I assume. They'll be notified when?
Yeah, well, I can't give you that answer specific to that. We're working with education and ensure we're informing people, and I think that pretty much any of the plans that we've put forward and our messaging to Manitobans is that we're in this for quite some time. It's challenging, and we're all going to need to adapt quickly to changes. And so this is not going to be an exception to that.
From the Brandon Sun, Bud.
Yes, Dr. Roussin from Brandon Sun. Can you tell me the community transmission rates currently in Brandon, numbers of percentages?
Yeah, and so I don't have the specific number there because a lot of them are still under investigation. We'd say still the majority are related to cluster or to known cases, but what we found was that at the beginning we had a single cluster that made up a large proportion of the cases. Now we're seeing multiple clusters that aren't necessarily connected, and so that's that indication that we're seeing some community transmission. And so it was enough and for a long enough period to make the decision to raise that level.
On the very first question, could you get someone to send me those numbers? And the second question would be, is there plans for more strident enforcement in Brandon to stop these large gatherings?
Yeah, I think that we can get those numbers, but also we're going to look if enforcement is necessary. then absolutely we're going to be looking at ways to do that. We want to get these numbers under control and continue on with our progress moving forward.
From CJOB, Diana.
Hi, Diana from 680 CJOB. Minister Friesen, I am hoping to get some answers on the contact tracing repository proposals that's just gone out. How many contact tracers are we expecting to need? How many are you expecting to get? And how important is this going to be to the province going forward?
Well, thanks for the question. We did launch an RFP to be able to solicit for interest to augment what we're able to do now on contact tracing. We've done significant things already. That whole apparatus that we have to be able to follow up cases, to find out where spread might have taken place, to inform people of the suspicion that they may have been exposed, and then to, of course, do the work of sending people home and keeping them home by checking in on them. We've got robust capacity. It is obvious to us that we must always be looking to get more capacity. This doesn't represent a high water mark. We know from Dr. Roussin that a second wave in the fall could see significant impact. So I think this is us not resting on our laurels, but continuing to hope for the best, but to plan for every scenario. I'm sorry I don't have the exact numbers, but we will see what this solicitation returns in terms of ability to add to what we have now.
And follow-up for Dr. Roussin, obviously the pandemic response system levels were announced yesterday. Were you expecting to have to move a whole health region, not just say one facility like the care home, into another zone so quickly?
Well, I mean, when we designed it, we designed it for that purpose, to do things at a regional level. So things like group sizes are difficult to do at much lower or much tighter than a whole regional level, because we know that a lot of the cases in Brandon were at large gatherings outside of Brandon. So we felt we didn't want to just have the group sizes imposed just on Brandon. So when we expected it, it's tough to know. I've learned to expect just about everything right now with this pandemic.
From the Winnipeg Sun, Scott.
Hi, Dr. Roussin. Question for you. I guess, okay, so it's kind of piggybacking off of Diana's question there, but so the reason, the Prairie Mountain Health Region, it goes, up to Swan River, even higher, Dauphin, those places. So are you, the reason that you wouldn't just put Brandon on that elevated to orange would be because is that more proactive then at that point to put the whole region, I suppose?
Well, it's a little bit of that, and it's also like we were saying that in Brandon, a number of those clusters and cases there acquired it traveling outside of Brandon into the other Prairie Mountain Health areas, in parks and beaches and things like that. So just imposing those restrictions on Brandon wouldn't get us what we want.
Okay, and a follow-up. There's a petition out. It's got about 12,500 signatures right now on reducing class sizes for the upcoming school year. Obviously, that might change in the Prairie Mountain Health Region, but may not change elsewhere. Is that something that is still under consideration at all, or are the class sizes, is that plan still going forward? What do you guys have now?
Yeah, and I think it's been clear that we don't ever have anything off the table, that we're always trying to adapt to the situation that we see. So right now we have those plans in place. It's a multi-layered strategy, so it doesn't just focus on things like class size. There's distancing, there's masks, there's screening, there's hand hygiene. So we're going to continue with looking at that plan and adjusting as we need moving forward.
Thank you, Doctor. We now go to the News Conference Theatre for questions.
Dr. Roussin, what indicators led to this decision? I know you said there's not one particular thing, but can you take us through kind of those couple that would have made this decision?
Yeah, so there's a couple indicators, and it's more the trend. So certainly we know that and I don't have the exact number in front of me, but the local test positivity rate, we know that there's increasing number of cases that we can't link to clusters. There's increasing number of clusters. So with that, and then also an indicator that we don't necessarily track is just the number of concerning exposures. Where we've heard of large groups at beaches and at parks where we've discovered cases. And so it really indicated to us that we have to strengthen our message there, get people back on track.
And I just want to be clear, when you go to Orange, there's a whole list of restricted things that could potentially happen, whether it's restrictions on schools and who can visit healthcare facilities, all of that. Right now, it's just the 10-person gathering limit and the mandatory mask.
That's right. Yes, and that's why we wanted to have this as a flexible and responsive program that we could base on what we're seeing. So we're not seeing transmission at retail outlets. We're not seeing transmission at restaurants, or not to a big degree. So we didn't want to have to impose restrictions on them.
Dr. Roussin, just some numbers to clarify. The website has 100 active cases in Brandon. You just said 95. Which is it?
The 95 is what I have of this morning, so we can look into why there's a discrepancy.
So 66 in the Brandon cluster and 61 at Maple Leaf?
Yes.
Okay, and just one thing to correct, no, I'll leave that off. Right now, how do you say gatherings have to have 10 people? There's no restrictions on restaurants, but if you go into a restaurant, there could be more than 10 people in the restaurant, and you're not going to be eating with a mask on. So
Yeah, so there are restrictions at restaurants, right? Restaurants must physically distance right now, so all those restrictions are still in place. And the issue with why we've treated gatherings differently than, say, even religious ceremonies and things is because we don't expect there to be controls, right? They're not planned events, they're not overseen. And so in a religious ceremony, they have people overseeing it, they're able to plan and adjust to it, and the same thing with restaurants.
I'm gonna still, I ask you this often, but has anything changed then at Maple Leaf? We have 61 up from 60 there. There is this elevated for the area. Where are discussions at over testing at Maple Leaf?
So with testing at Maple Leaf, we're still not looking to do just sort of widespread asymptomatic testing, but what we are looking at is, because they've been doing such a great job of many controls, and one of those controls is cohorting of staff. And so we're looking at where there's active cases, even if there wasn't any significant hint of transmission or exposure, we're going to start offering testing to those cohorts, which will increase some of the testing. But still a lot of procedures in place, and we're still not seeing evidence of interfacility transmission at this point.
Dr. Roussin, the cases are going up, but hospitalizations aren't. Is that because mostly your young people are the ones testing positive? And are we doing enough? Are you doing enough to get the message to young people? Like, do you want to kill your grandmother? I don't know. What should the message be, and is it getting to the people who need to hear it?
Yeah, and so the hospitalization rate, there's a couple things, and we can't really know what's driving it. And so one is, you're right, there's a lot of younger people that are testing positive, which we know have much less hospitalization rates, and so that may be the reason. We also know that there's a significant lag between cases and hospitalization, that it's usually that week to 10 days before somebody does require hospitalization. So we still will follow that lag. And then the messaging to everyone. I think that's what this pandemic response system was for, is that we see in Prairie Mountain Health that you're right, not everyone's getting the message. And we hope that raising that alert level, imposing some targeted restrictions will be able to do that.
And can you explain why children don't transmit the virus as often as adults do? And what is the evidence or the science?
Yeah, and so just like everything else, this is emerging, and you'll see reports where certainly kids are affected. We see cases in children, but they're certainly underrepresented overall, and they're underrepresented in severe outcomes. And then there's some evidence that shows that the younger the child, the less likely they are to transmit it widely. But there's some conflicting evidence with that as well. And there's no solid reason why. There's some thoughts that there might be cross protection between the circulating coronaviruses that we see every year that children get that get very often. So there might be some cross protection there, but that's simply just a theory at this point.
Dr. Roussin, on a similar note, your Alberta counterparts recommending staff and teachers get tested before they go back. What are your thoughts on that?
Yeah, so to speak in the Manitoba context is if we're not entering a bubble, then there really isn't much benefit to widespread testing, because if you're negative on day one, well, in fact, you'd be negative 2 days before day one. It doesn't mean much for day 2 or 3 because you're not entering a bubble. So in the Manitoba context, that's not something that we're actively looking at anyways.
And are there any thought to travel restrictions in Westman as a result? I'm asking that because since this announcement's made, that's the number one question I'm getting from people who are consuming this press briefing.
Yeah, so at this point, no. At this point, we haven't certainly implemented any travel restrictions. Like anything else, we're always, thinking on what implications any restrictions may have and what benefit they may have. So as of right now, we think the epidemiology is telling us that these large group gatherings are what's driving a big proportion of this. So that's what we're focusing on.
Have you kind of given up on the contact tracing app? Yesterday you said, yeah, it's like another thing that we could do, but it's not going to be a solution. Is it sort of something that's off the table now, or is anybody?
No, that's still on the table, and we're still reviewing that. We don't have any imminent plans to implement that. And like I said, it's going to be in addition to our contact tracing. It's not going to replace contact tracing, but I think that as we move forward, right, that's our theme, is to move forward, to live with this virus. If there can be some technology that will aid us in doing that, then we'll certainly look at that.
This fall or this winter?
It could be. I don't have a date on that. We're actively looking at it.
Mr. Friesen, is there any additional supports that are going towards Brandon during this time? Mask support, I know that the city there was looking at something. What is the province doing specifically to help people in the area?
Well, we're providing broad support every day in our system, and as you know, we're making careful plans for things like even mandatory mask use in hospitals, and there obviously we're not going to turn anyone away if they show up without a mask. So there's broad support throughout the system as we continue to plan. As specific to Brandon right now, I think the best support that we can give as a government is providing this limited notice period, as Dr. Roussin said, to allow them to understand what they need to do before Monday's these conditions go into effect.
Dr. Roussin, I've got a random question about back to school here that we've been getting a lot from people that are wondering and curious about music classes and sports and how that's going to work. Are kids going to be able to play instruments, sing, have those after-school activities and sporting events?
Yeah, and so there are guidelines for all those things on our website, and school administrators have been looking at those and applying what fits their schools and divisions best. And so there are concerns with it. Certain sports that are non-contact, distancing can be quite feasible. So those could go ahead if it's feasible. Others will require some adapting. Maybe others might not be able to go for it. And same thing with singing and band. It's there's cautions there, and so it's not necessarily excluded, but there are added cautions.
Forgive me for being tedious, because some of my colleagues have heard you say one thing, and I heard you say another. And when I checked, 66 in the Brandon cluster and 61 at Maple Leaf, or 66 at Maple Leaf and 61 in the Brandon cluster?
I have the Brandon cluster at 66. And then the total Maple Leaf at 61, where I think that 21 of the MLF also belongs to the cluster.
And to be equally ponderous, your press release states Manitoba Park's on Lake Winnipeg. It's actually on Lake Manitoba.
Folks, if I can just quickly interject, Minister only has about 2 to 5 minutes left. If you have any specific questions for the Minister, you can duck out and the doc can stay if need be.
Minister, for you, related to education, and forgive me, these questions are similar every day, but every day we get a little bit more information. The Premier made it clear yesterday that he is willing to speak to the school divisions and find out what their needs are. We know you're spending money on masks. We know that there's 48 million in existing funds. Every day you're probably hearing more. Would this be a health expenditure, or would it be an education expenditure to provide further funds for either operating or capital for the school system to safely deliver the pandemic response?
So it's a good question. I think that right now I will preamble it by saying that I think Manitobans care less about the accounting of these things than they care about the safety of these things. But obviously we do need to book these expenses somewhere, and these expenses matter. Let me tell you what we did in healthcare. When it came to personal care homes who we knew would have additional expenses because of the pandemic, we told them to carefully track all of those expenses. We gave them notice. We asked them to track them. We said that those would have to be constrained to COVID-19. They would be subject to audit, but we are prepared to reconcile those costs that they've had. I can tell you that those quarter one invoices, or that call for invoices, is now going out to personal care homes. My feeling would be that much the same would be in case of education, where we would be telling school divisions to track their expenses for reconciliation.
Dr. Roussin, when we talked to you yesterday, and we were asking if Brandon was going to be moving in this direction, you said, we're keeping a close eye. Is there a warning that you want to put out to anybody else in the province right now that is possibly close to where Brandon was yesterday?
Well, I mean, I think that's, certainly this was a targeted approach, our pandemic response system, but the message really is province-wide, is that we see these increasing numbers, likely have lost track of some of the things that benefit us all, and then we see these numbers rise, and so we see that there's no place that's safe from this in the province. So the message is that, get back to those fundamentals, and we'll again see these numbers start to come.
Have your eye on a specific industry or area right now in particular?
No, I mean, nothing specific. I mean, certainly in Winnipeg, we see some community-based transmission. We haven't discussed any further restrictions there, but I mean, we're definitely looking everywhere.
Dr. Roussin, yesterday you said the goal is to get to 90% of contacts within 24 hours. You're at 87. Is that all named contacts for each infected person? And also, what's the rationale for the 90% target?
Well, a lot of this came from some WHO guidelines early on, and it's kind of a typical guidepost for contact investigations. And so, so it's we'll do the case identification and then the case investigation, and from that we'll get the contact list, and then we expect to reach each of those contacts within 24 hours of being notified of them.
Do you know how many total people have been contacted as contacts?
Yeah, no, I don't have that.
What about the numbers, like 25? We were talking about last week, there were cases where there were 25 people that you had to track down for each case. Are you seeing any more of that? Has that improved? Are you seeing more contacts?
Well, I think with these concerning contacts that we announced here today, then we would see numbers like that. I don't have them in front, but like I said, the trend since our phases is that each case is having an increased number of contacts that they name. And then we saw some outliers that had a very large number of contacts.
Just more on the education, to follow up on the question I asked you about the source of the funding, and that will become important later on, as you understand. What areas of education do you think, in addition to masks, will be first for upgrades? Obviously ventilation, that takes years, but what other areas? We continue to hear smaller class sizes. We know that that's not something that's going to happen immediately, or if at all, and it's not on the radar. But what is the next area in the education system that could see provincial funding after masks?
So I won't hypothesize here because I'm not the Minister of Education, but I can tell you those conversations broadly are taking place right across the span of government. In fact, only yesterday I spoke and met with Minister Helwer, Central Services Minister, about investments that were being made and planned to be made in respect of ventilations. Of course, as Dr. Roussin has said, the jury's still out whether there is actually amelioration that can take place when it comes to very costly and upgrades to ventilation systems. But I think that Manitobans know the kind of things that are basic and most effective when it comes to addressing education settings. It's distancing. There'll need to be partitions. We're going to need to be able to sanitize surfaces often. There might be human resources needed to be added for those kind of things. I think of it as being analogous to what we've done in healthcare settings. And even though the infection and prevention and control measures in a hospital hospital are necessarily higher. The same types of things will be in place. So I know that the minister and his staff, alongside superintendents and their administrations, are all planning and working together with other partners to figure this out and get information in a timely way.
Dr. Roussin, thank you for that. Dr. Roussin, on the large gatherings at parks and beaches and things like that, we've heard that those aren't as much of a risk as indoors, but why have outdoor gatherings become a problem in Manitoba when we see health officials in like Vancouver say, we're not that freaked out of everybody on Wreck Beach? Why outdoor gatherings?
Well, I mean, it's not only outdoor gatherings, but it's part of it. And so we're seeing very large outdoor gatherings, and then we're seeing very little attention to the physical distancing in there. And I think that it's all part of the messaging has to be clear, is that we're not back to normal. So certainly outdoor gatherings are less risky, but there's not zero risk. But when we get that sense that we are back to normal, that this virus really isn't a risk to us, we're going to see numbers creep up.
Will you close beaches at Wasagamine, Dauphin Lake, other places in Westman?
We don't have plans to do that. I think the group size will accomplish what we need there.
Do you have any idea how high the test positivity rate got in Brandon? I know you said you didn't have the current number, but what their maybe peak was?
Yeah, it's just, I don't have that in front of me. It's just a metric that we're just finalizing now. The denominator sometimes is tough to file there, so I don't want to guess on the number there.
Is that for Brandon or the Prairie?
And that's the thing. It's tough to know the denominator when we start testing like that, but it'll probably be reporting it by a region.
Is that a number you can get to us today? I mean, it's
I don't know if I can get that.
Something that you look at. It's one of the indicators you said.
Yeah. I don't know if I can get that today, but we'll get that to you. Yeah.
It's higher than the 1.8?
Yes.
Can you say what some of those other clusters in Westman that were concerning, besides the business that we call Maple Leaf?
Right. Yeah. So we did see a number of clusters. So it started with one large cluster that was connected by a community and by a geographical area, and then we started seeing a number of other similar type of clusters form, but that weren't really connected to it. So and then so as we see increasing numbers, we're still able to connect them to a cluster. But we're seeing more and more clusters, and then with that, we're seeing some community transmission.
Do you have like a visual representation map of the clusters and the people and the lines?
That's something we're working on right now.
Will you release that?
I don't know if the balance on stigma that we have and things. So I don't think we would get down to a neighborhood type map that we would release.
Do you know what our community transmission is in the Prairie Health region?
Well, not the specific number. We have these number of cases that we've announced yesterday. Today, they're still under investigation. So,
what's the latest or most recent community transmission rate for the province overall that you can give us?
Yeah, so the whole province for the 7-day non-EpiLink cases, we have 53. But again, that's probably a large overestimate because there's just a number of them we haven't linked yet.
There wasn't much change from yesterday when you were looking at like 19%-ish or something.
That's right, yeah.
And call it a day.
Thank you very much for that.
Thanks.